Hi, this is Dr. Stefan from interstitiallungdisease.info. In this video, this Bits of ILD presentation, I'm going to be covering the classification of idiopathic interstitial pneumonias, just to delve into the letter soup, the alphabet soup, or whatever you want to call it, of all the acronyms that are considered conditions. So we don't have very good names. We don't call conditions hypertension or diabetes or whatever. It just has a lot of these acronyms, and it's important to be familiar at least with the classification of idiopathic interstitial pneumonias, to at least recognize when these conditions are presented to you on a report, on a patient letter, or you read about it somewhere in a journal. So let's delve into it a little bit. I won't keep you long, but I think it's useful to have this information. The disclaimers as before: this is not medical advice if you are a patient, and if you are a health professional, this is, again, you need to use your own professional judgment when you're treating patients. That being said, that being out of the way, we are talking about interstitial lung diseases where the cause is not known. So you have scarring of the lungs, you have inflammation of the lungs, you don't know what the cause is, you can't find the cause, and then you classify the condition based on its pattern, based on its presentation, history, other factors, into, let's say, an idiopathic interstitial pneumonia, or an IIP. This is classified as such. So the IIPs, this is where it gets really fun, because you have a lot of these acronyms: IPF, NSIP, RBILD, DIP, COP, AIP, LIP, PFE. It's a mouthful. So I understand this is basically the latest iteration of the classification that's been suggested by the American Thoracic Society and the European Respiratory Society. This is from 2013. These are being constantly updated. The main one you may have recognized from this classification in the major idiopathic interstitial pneumonias is idiopathic pulmonary fibrosis, or IPF. This is by far the most common one. But there are these other things you may have heard about as well. So NSIP, idiopathic non-specific interstitial pneumonia. Again, this is one of the idiopathic interstitial pneumonias, the IIPs. Respiratory bronchiolitis interstitial lung disease, RBILD. Desquamative interstitial pneumonia, DIP, and cryptogenic organizing pneumonia, COP or COP. Acute interstitial pneumonia, AIP, and then you go to the more rare forms, which is the LIP, lymphoid interstitial pneumonia, pleuroparenchymal fibroelastosis, PPFE. And then when we can't find the classification, because sometimes these conditions can be so strange and so hard to classify, we just call it unclassifiable idiopathic interstitial pneumonia. So this is the classification. I just wanted to make you aware that this classification exists. And obviously, if you are studying or learning about interstitial lung diseases, you want to be an interstitial lung disease doctor or want to work in this field, it's important to at least be aware of these conditions, because you will see them as diagnoses when your patients come to see you. And it's important to at least be aware that these are interstitial lung diseases and not something completely strange. I'll see you in future videos. Hopefully this was helpful. All the best.